Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Dr. Robert Kirstein. Robert is the world's leading author on the subject of digital occlusion technology. Dr. Kirstein lectures worldwide on this subject, and today we're discussing his course, Digital Occlusal Technology in the Daily Dental Practice, Taking Treatment to the Next Level. Thanks for joining us, Robert.
My pleasure.
So give me a little information around what prompted you to create this course.
Well, dentists have a real struggle sometimes with putting in dentistry and having patients struggle with the aftermath, where they routine visits many times to get their bite adjusted after having a few crowns done or filling done or even something larger. And bite discomfort is a major issue, a loss leader in dental practice, where they share time treating patients in ways that is very unproductive. So the T-scan technology, the digital occlusal technology, is a great solution for that. It quickly identifies problem contacts and makes it very easy to resolve patients who are having post-insertion difficulties, which unfortunately is a very common malady for the dental practice and often costs the doctor a very productive chair time.
And so who are the appropriate audience for this course?
Dentists, general dentists who install dentistry, which is you can have the bite change on fillings, you can extract a tooth and have the bite become uncomfortable for the patient. And so this aftermath of procedure that has a role in is common to the daily general practitioner. And it's a real difficult thing sometimes where people need extra visits to come back and they don't have a good way to resolve them. And this is where the T-scan technology is measurer, time measurer, and it makes it very simple for the dentist to be able to correct these bite problems that often nag their practice for weeks, months at a time.
So do your attendees need to have the T-scan technology in-house would this be an appropriate course, across the board at all dental meetings, or can you give us a little more idea about the fit on that?
Well, this course is designed to illustrate the applications of the T-scan to a dental practitioner so that they might consider what could help them and possibly get involved in it. It's not a course that they need the technology. There are courses that train people to use it, but this is more of a course designed to illustrate how technology is helpful in daily dental practice with many of the things that go on routinely.
And maybe be able to help them solve some issues that they otherwise would not have had the understanding and skill to just resolve around occlusion.
Oh, absolutely. The biggest loss leader, as I said earlier, is this wasted time post-insertion that plagues dentistry. And it mostly has to do really with the fact that the articulating paper marks that people use do not measure force and time in a way that's useful and predictable. And the T-scan technology does that. So it makes it readily simplistic to resolve a lot of these bite issues that plague practices.
I see. So we're talking about, sounds like maybe more the general practitioner. Do you have levels of this course or other versions that would be for more specific or advanced applications?
Yes, the T-scan has many applications in dental practice, from implants to TMJ, from aesthetic smile design, material preservation, preservation in the bone, periodontal disease, post-orthodontic uses. So we have courses that detail these things as well. And they are specific to the topic, such as using the T-scan to finish an orthodontic case, or how to install implant prosthodontics using digital occlusion technology. So we have courses that are targeted for the specialists as well, but the introductory course is really aimed at the general practitioner who has difficulty managing daily occlusal issues.
Got it. Well, are there any parting thoughts on this subject? Anything important that you'd want the meeting planner to know about bringing this course to their meeting?
Yes, I think that this technology is very unique as far as meeting planners go because there is a vast area of knowledge that's been accumulated about the T-scan in the last 30 years. It's been available since 1984, and it's a whole new avenue in occlusion. The digital occlusion is really completely different than the non-digital. Relies on stone casts and articulating paper and a lot of subjective assessments of the bite, whereas the T-scan technology, the digital technology, is a major advance in the daily practice of occlusion, and it offers great advantages to many attendees who might be interested in improving their ability to manage their occlusion issues in their practice.
That sounds wonderful. Well, there you have it. For information on bringing Dr. Robert Kirstein to speak for your next meeting, please visit dentalspeakersbureau.com. Thanks for tuning in, and thanks for joining us, Robert.
Thank you.